to the programme. 13 minutes past 3 o'clock is the time. Well, following the deaths of at least 5 people and in application of international health regulations, the government... The cases were linked to the burial of a nurse near the Liberian border on the 1st of February. I'm joined on the line now by Dualta Roughneen, a native of Kilchama in County Mayo, Head of Programmes at Plan International Ireland. And Dualta, good afternoon to you.
Hi, Aidan. How are you doing?
Very well, thank you. People will know that Ebola devastated Guinea, Sierra Leone and Liberia only a few short years ago. How serious should we be about this new outbreak in Guinea?
Oh, it should be very serious. It's very early days to know if it's going to be anywhere comparable to the outbreak in 2014-15 that kind of devastated that region, those 3 countries in West Africa. There were 11,000 deaths in that year, but the Ebola virus is something else entirely. You know, it's not to make any comparisons to coronavirus. They're completely different things, but if you get Ebola, you know, you've a 1 in 2 chance that you're going to die, and you're going to have a fairly horrific death as well. It's one of the things about Ebola and why it causes so much fear, especially in those regions, is that the countries have been witness to the outbreak a few years ago, and it's at a different level at the moment. It's early days, and the government in Guinea has responded very quickly to the outbreak, so hopefully they'll be able to keep it under control in the next few weeks, but it's very hard to know because of the nature of the country, the nature of the outbreak as well, where it's happened at the moment, where the cases have been identified and the deaths have occurred. It's a town that's kind of at a crossroads between Guinea, Liberia, Sierra Leone and the Ivory Coast, so there's a lot of movement in those areas, so it can spread very quickly if people have been moving about before it's been realised, and trying to identify the close contacts of people who've already been identified with having Ebola is a challenge.
And of course, you mentioned there the comparison with COVID-19. As I understand it, and you'll correct me if I'm wrong, the Ebola virus, 1 in 2 chances of death, as you say, and it doesn't really matter whether you have underlying medical difficulties or otherwise, that it can be ferocious in terms of its impact.
Yeah, listen, Ebola doesn't discriminate at all. One of the things we learned in the last outbreak was it was very random who'd survive and who wouldn't. You know, there was no age demographics that told you had a chance of survival or not, whether you're male or female, elderly or a child. It just seems to hit some people completely different to others, and some people died, some people didn't. We never really know why.
And then in terms of curbing its spread, how can that be done? I know you say that this is early in this outbreak, but what can government do, and indeed other governments from across the globe, in terms of helping the government in Guinea to deal with this?
I suppose the first big difference between now and the last outbreak is that there is a vaccine for Ebola that was developed over the course of the last outbreak. It was never available at the time when Guinea, Sierra Leone, and Liberia were trying to manage the last outbreak, but since then it's been developed and it's been rolled out in Guinea now at the moment. It's similar to coronavirus vaccines in that it has to be stored at very cold temperatures, but they're already giving out the vaccine to people in close contacts of those identified having Ebola already. So they're taking what they call a ring method of vaccinating all the people who may have been in contact, even if they haven't been identified exactly as a close contact. So they're trying to curb the disease very, very quickly. So that's what they're doing there, and also with the support of the NGOs and the international organisations, the UN as well. They're really trying to get ahead of the curve on this. You know, they're trying to get the information out there to the people in the area across the country and in the neighbouring countries as well, that this is happening and that they need to be aware of it. They need to communicate very, very quickly, and for people to self-isolate at all if they have any of the symptoms. One of the problems is that Ebola is very similar to a lot of other illnesses that affect the region. The last outbreak, there was delays identifying the first cases because Lassa fever, it's almost identical in how it manifests to Ebola, but it's just it's not near as fatal. And people thought that it was Lassa fever outbreak that was happening, when in fact it was an Ebola outbreak, and it meant that it spread far and wide before it was being caught. We hope that it's been caught and realised early enough that we won't get the type of movement that spread it across 3 different countries. So far there's no cases in Sierra Leone and Liberia at the moment, which is good news, and trying to keep that going is going to be a challenge, because Guinea, it's a poor country essentially. It doesn't have the resources like we have here the robust health systems in place, to be able to do the things we can do when we're fighting diseases and outbreaks. But a lot of work at community level is important. What the Guinean health system needs now is kind of the logistical support to enable them to manage the vaccines. They have a cold storage system in Guinea at the moment to store vaccines, to transport them, but again it's rudimentary, and having the resources to do that even better, and be able to scale up if they need to scale up if there is a spread of the virus across the country. There's a concern that it's in an urban area, so people are in close contact with each other, but if it moves into the capital cities in the region as well, it's going to be a bigger challenge.
I was reading earlier, Dualta, that during the previous Ebola epidemic, girls and young women were particularly hard hit. Is there a fear that might happen again?
Listen, like I was saying, in terms of people contracting the virus and dying from the virus, it's the disease doesn't discriminate, but it's the knock-on effects, of when you have an outbreak of Ebola, similar like you have in COVID-19 here in Ireland and across Europe, across the world. You have to shut down particular areas of the country to try and manage it, and when you have that shut down, those lockdowns, they have a really strong impact on all the population, but particularly girls and young women as well. Like we saw in Sierra Leone, there was a big massive increase in teenage pregnancies because of the lockdown, because of the restrictions that were there. They get hit hardest in those countries with the working in the informal economy. There'd be the people who would have stalls set up with micro businesses, selling on the sides of the streets. All those things were severely restricted, meant they weren't able to look after the livelihoods and the livelihoods of their families as well. And they would really be dependent on that type of work and day-to-day living, subsistence economy that girls, women, mothers would be involved in. So when that happens, they don't have the support systems again like we have here. There's no PUP in places like that. So if you can't go out and earn from one day to the next, you're not going to have money to go and buy food for your next day's meals.
You were in Sierra Leone in 2014, and you witnessed at first hand the devastation it caused, and indeed the disproportionate impact it had on girls and women. In the context now of COVID-19, is Guinea basically facing both?
Yeah, Guinea is at the moment, across Africa. In a lot of the developing countries, like COVID-19 has already caused a lot of problems. The numbers of the outbreak, they're not at the same level as they are here, but a lot of that is probably down to the lack of testing equipment and systems to identify cases of COVID-19. So it's very hard to know exactly the numbers in those countries, and they followed the same path we did in terms of shutting down the economy and shutting down schools. Very, very quickly last year. But one of the things they realised as well is that, and it's possibly partly down to demographics, because people don't live as long as we do here, and the 70s and 80-year-old demographic that are the most vulnerable to COVID, and the average age in those countries doesn't generally get that high, so the impact mightn't be as strong in that area. But they also realise they've got so many different issues to deal with, that shutting down the economy, shutting down the schools wasn't necessarily the best approach for them in those countries, because the support systems, the resources aren't there to manage those and kind of to sustain the country over the period of time that we've been able to do so here in Ireland.
And is the international community conscious of what's happening there, or is it the case that because of the pandemic, countries are concentrating on their own circumstances rather than being concerned or overly concerned about Guinea?
I'd say there's an element of, I think, especially where we are at the moment, in terms of hopefully looking towards some light at the end of the tunnel in Europe around coronavirus. There's probably been a lot of focus internally, less so looking at places like Guinea and the impact there. We're seeing I suppose some of the discussions around vaccine nationalism, where the priorities of the vaccines are going to the countries that can afford them most. There's very few countries in Africa that have been able to start rolling out vaccine programs and have been able to access vaccines as well. And that's a challenge. That's a COVAX scheme, that's been supported by countries here where there's going to be at some stage, vaccines reaching those countries, but it's very difficult at the moment because they can't compete, I suppose, with the markets that are here in Ireland, and they also don't have the resources to necessarily roll them out. One of the things I was just reading earlier was like Nigeria, near to these countries, now they've done a testing, antibody testing in Lagos, and they've identified that 23% of the population there, they think, had COVID already, but they haven't been able to do the testing to identify all those cases earlier. So it's a completely different scenario that these countries are working in.
Yeah, and I was listening to Dr. Mike Ryan of the World Health Organization last week, and he was making the point that underdeveloped countries, or countries whose economies wouldn't be as developed as the West, cannot be ignored in terms of COVID. But I would imagine at the same time it can't be ignored either in the context of Ebola.
Yeah, I mean, they're two very interlinked issues, especially when they're overlapping already. Like in Guinea, Guinea's been struggling to do the basic kind of identification of cases of COVID-19, and like Ebola puts a completely different outlook on things there. Can't be ignored, and it's not just for the immediate impacts. If Ebola spreads in the West Africa region again, like it is in 2014-15, like the economies will be devastated. You'll see a huge setback in terms of kind of development as well. Like for Sierra Leone, Guinea, Liberia are still recovering, even education-wise. An awful lot of people missed out on years of education, and once people drop out at their teenage years in school, it's very hard to get them back into school again as well. And we've seen that, especially with girls. There's not quite a generation, but there's a portion of a generation now that have missed out on their education and won't ever be going back to school. To complete second level education, which is a huge problem. Without education, it's very hard for countries to look after their own development and move forward.
And the role of Plan International Ireland in aiding the government of Guinea in dealing with this?
Well, at Plan, we've a very, very strong office in Guinea. They learned a lot in the 2014-15 outbreak. We're working with the National Health Ministry to give them support in logistics around rolling out the vaccine around the COVID-19 outbreak. We've been providing support with them through funds from Irish Aid, Ireland's overseas aid programme as well. We've been using those resources just to get the basics in schools and in health centres, basic hand washing facilities, hygiene, just to ensure that basic standards are being maintained. If some schools have reopened and children have went back to school as well, to ensure that they're able to maintain social distancing and to be able to attend school safely. We're just putting in the basics in place. We're not a medical organisation, but we're working in the ecosystem around the health centres to ensure that things are in place and that medical personnel are able to operate safely and effectively.
And just one final question, and it's courtesy of a text that has come into us. At a personal level, do you find this type of work rewarding or draining or what?
Depends on the day. Nowadays, when I was in Sierra Leone in 2014 for the Ebola outbreak, it was a tough time for the for our team there, who are 95% would be from Sierra Leone, and they were really struggling. Like their families, their communities were all affected by the virus. They were, struggling to figure out what was the role of an organisation like Plan when Ebola had hit the country. That was the first time it had hit Sierra Leone or Guinea or Liberia, and they felt that they had to be doing something because they'd worked in a lot of these communities for a long time, and Plan was seen as being a very strong support. But we really had to figure out what was the best role we were able to play, and I felt that we took some risks as an organisation. Had to step outside our comfort zone for the type of work we were doing to start engaging in working around Ebola treatment centres, to try and work safely for all of our staff, in an environment where they were at significant risk of contracting a very fatal disease as well. And it was a very difficult time, but it was rewarding because I felt that we did quite a lot of good work over the course of that outbreak, and in Sierra Leone, and I think in Guinea as well. I wasn't there, but I think we contributed in some way to I suppose, curbing that outbreak and bring it under control. And it's been 5 years now since they've had no cases of Ebola in the region, but this new outbreak now is a concern again.
And just one question, and I should have asked at the start. I did say that the cases were linked to the burial of a nurse, but is that because the nurse had it, or is this just speculation, or how has it returned to the country?
That's the thing, always finding the original source of where Ebola comes from whenever there's an outbreak. There's been not a huge amount, in the last 40, 50 years, but every couple of years, often in the Congo, outbreaks happen in very rural areas, and theories are where it comes from initially. It's thought that there's a fruit bat that carries the virus, and somehow then it transfers to a person, how they pick it up, whether it's from eating fruit or eating the meat of the animal as well. Sometimes it's never fully sure, but then it's kind of the secondary spread of disease once someone picks it up, however they've got it. Something like a funeral, because people aren't aware that it is Ebola, and funerals in Guinea and in West Africa, they're very tactile events, so there'll be big crowds at the funeral, as a normal funeral would be, and there's traditions there where people do touch the body of the person that's died, and it's a ritual that exists. And we saw in 2014, it was one of the big challenges was ensuring bodies could be buried and funerals could be carried out safely, and getting the message across, that the usual way of carrying out burials and waking bodies couldn't be done. And that was very upsetting for a lot of people, because it's not just a cultural practice. It's very much linked to people's faith, to their traditions, to honouring the dead and honouring their descendants as well. So those things were very, very difficult and caused a lot of upset, and a lot of people weren't willing to accept that they had to give up these things, because they felt there were kind of spiritual consequences to not being able to honour their dead as they were supposed to as well.
Very good. We must leave it there. Dualta Roughneen from Kilchama, Head of Programmes at Plan International Ireland. Thank you very much indeed for joining us on the programme this afternoon.